Okay, Marita. Okay, Marita.
Ready? Good morning. Welcome to the third virtual Board of Supervisors meeting. And to county staff out there, we thank you very much. And to the public, we appreciate all that you're doing to be safe. Thank you. If you can, please stand and we'll do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Madam Clerk, could you please read out from the closed sessions we had last week?
Thank you, Madam Chair. Pursuant to Government Code Section 54956.9D1, conference with legal counsel regarding existing litigation, California Sport Fishing Protection Alliance v. Eastern San Joaquin Groundwater Subbasin Sustainability Plan et al., Stanislaus County Superior Court Case Number CV 20001720, there was no reportable action taken. Item 2, public employment pursuant to Government Code Section 54957B1, Title County Council, there was no reportable action taken.
Are there any staff announcements that you know of?
No, there are not.
Okay. I'd like to move to public comment. If anyone in the public has something they'd like to say, if you could please call in or email, because all the doors to Government Center are locked.
I'm sorry, Madam Chair, we don't accept emails during the meeting.
Oh,
If the public would like to comment, they can call 669-900-9128 or 346-248-7799. The meeting ID number is 917-7514-755, and the password is 804433.
can you flash that on the screen and we'll wait a couple of minutes?
I certainly can. Why isn't it showing? There. I thought I did. Oh, okay, I got it.
Diane?
Just one moment, please. We think we have a caller. Caller, are you wanting to make public comment?
They're asking for public comment right now.
Hello? You're live
Hello?
with the Board of Supervisors. Are you wishing to make a public comment?
Hello?
Hello? You are live with the Board of Supervisors. Are you wishing to make a public comment? Number ending in 886. I'm sorry, we can't hear you. Close public comment. Sorry, Madam Chair, we don't seem to be.
Okay, Diane, why don't we leave the numbers up for consent? And we
Okay.
can all be small.
Okay. So moving to the consent agenda. Consent agenda items are expected to be routine and non-controversial. They will be acted upon by the board at one time without discussion. Any board member, staff member, or interested party may request removal of an item from the consent agenda for later discussion. If you would like to comment or pull an item from the consent agenda, you can call the numbers on the screen now.
Does any member of the board wish to pull a consent agenda item? Does any staff member wish to pull an item? And does any member of the public wish to pull a consent agenda item?
I don't believe we have any calls, Madam Chair.
Okay. Seeing that no one wishes to pull an item, I'll accept a motion on the consent agenda, please.
So moved, Madam Chair.
A motion by Supervisor Stopper,
I'll second.
Second by Supervisor Tuffanelli. All in favor?
Aye.
Aye. Opposed? Passes on a 5-0 vote of the board. Thank you. Would like to move now to item 5.
Item.
Oh, sorry. Item 3, the regular agenda. Thank you.
Okay. Item 3 on the regular agenda is from Health and Human Services to receive an update presentation from staff on COVID-19 novel coronavirus.
Dr. Kaleda, Mrs. Strange.
Yes, good morning, Madam Chair.
Good morning.
This is Dr. Kaleda. All right, well, I'll just begin what I'm going to say by giving you some numbers like we've done in the past. So as of Tuesday, April 21st, there were 30,978 cases of novel coronavirus infection within California and 1,208 deaths. Calaveras County has 12 reported confirmed cases of COVID-19 to date with no deaths. There have been 3 cases reported in the past week. One is in an adult male in Valley Springs, and the other 2 are in household members in the West Point area. So all 3 of these new cases are considered either imported into the community with exposure outside of our borders or epidemiologically linked to established cases. So there's not a thought of community transmission associated with any of these 3 new cases, which is an important distinction that we've talked about before. So far, Mark Twain Medical Center and the healthcare system of Calaveras County has not been overrun. Hospital surge plans have been activated to increase bed capacity, ICU beds, ventilator capacity, and public health has set up a 30-bed alternate care site at Calaveras High School in San Andreas. Statewide, as well as our local public health stay-at-home orders, have enhanced social distancing activities and effectiveness. So we're successfully flattening the curve. We're delaying new case occurrence, and we're sparing the healthcare system. So I'm really proud of the job our county residents have been doing in this area. The sacrifices on the part of the public in suspending group activities, non-essential business and travel, basically sheltering in place over the last 4 weeks have significantly blunted the impact of COVID-19 epidemic on our community and our saving lives. But let's be clear, the public is growing weary. People are increasingly frustrated, anxious, and looking forward to getting back to life as we used to know it. So to allay these concerns, I think it will be helpful to broach the concept of what opening up our community entails. So I'd like to provide some scientific and evidence-based predictions regarding what factors need to be in place to allow for the institution of relaxation of the current stay-at-home directives and what timeframes we can expect this to happen in. I'll preface these predictions on the facts that the state of California indicators and guidance would supersede my projections. We're still under a statewide stay-at-home order, and these underlying assumptions are that social distancing activities will continue in place until deemed no longer needed, and that new case counts will remain low, and the governor's stay-at-home order will in time be rescinded. So let's start with the late April to middle May timeframe. I suspect the number of new cases will continue to be flattening, and the relaxing of community mitigation activities is contingent upon the outbreak remaining stable and transmission of disease being controlled. That's an important initial step that's necessary before discussing relaxing the social distancing measures. So under this scenario, I would propose in early May, the reinstitution of solitary outdoor activities such as golf, parks, hikes, under these conditions, assuming that they be conducted in adherence with strict social distancing practices. The stay-at-home orders should persist toward the end of May and into mid-June. Antibody testing should also become available by this time frame to help identify those with immunity and allow for safe return to the workforce. By mid-June to early July, the easing of stay-at-home policies can start to be considered more realistically. By early summer, we should see tailored approaches for getting people back to work. One size won't fit all. We'll need to, a lot of this will depend on how capable public health is in containing new outbreaks and having beefed up staffing to aggressively investigate and identify them before they grow out of control. High-risk people will continue to need to shelter in place. Immune individuals, those identified with antibody testing, can start to go back to work first. Reopening of stores and restaurants can start to be considered during this time frame of mid-June to early July, but limiting the number of patrons, wait staff, maybe wearing gloves and masks, disposable menus. Things won't look exactly the way that we're used to, but the initiation of some of those restaurants and non-essential businesses would be able to start to be put into place in a phased and staged fashion in this time frame. Employers would be encouraged to continue to allow telecommuting for eligible and applicable businesses and employees. Late summer, measures will be in place at that point to rapidly detect and respond to disease resurgence. Schools should remain closed, no summer school or other school-based activities such as daycare. Schools will likely be able to resume in the fall with social distancing. If increased case counts result, schools will need to send students home, close individual schools on a case-by-case basis, or again, widespread district closures may need to be put into place again if we start to see an increase in disease occurrence. Factors that could alter this time frame, in addition to improved testing capacity and beefed up public health department staffing to test, contact trace, and isolate new cases, we may see new drugs. We may see a vaccine coming down the pipeline at some point, probably not for the next 12 to 18 months. And there may be some viral susceptibility to warmer weather that we don't know yet. So I'd like to encourage the public to stay vigilant for the time being, to stay flexible, to continue to hunker down for the time being. If this first wave declines, we could be in store for a second wave starting in October or November later this year. And if we relax too aggressively the social mitigation activities that we have into place, we may see resurgence of case counts and undo all of the work that we've done up to this point. So I just thought it would be helpful to initiate a conversation about what the factors are going to be that are going to need to be taken into account to begin to relax the stay-at-home recommendations and get life back to normal as we know it. So I'm open for questions. Thank you.
Do any of my colleagues have questions for Dr. K at this time? Ms. Strange,
Did I cut out for a while, Madam Chair? When I
well,
was
your mouth
talking?
wasn't moving, but we could hear you.
Okay.
That's magic. Oh, Jack?
Thanks, Marita. I apologize. I should have hit the little raise your hand button. Doctor, thank you so much for all this work. And, you answered a lot of the questions that I had by laying out sort of that timeline, because I think you're correct. That's what everybody's trying to figure out. And it sounds like you're working through a process that seems very responsible. And I appreciate that. I always ask the same question. So is there anything else you need from the Board of Supervisors to help you move forward?
Yes. The mitigation activities that we have into place right now that have been a sacrifice to the community are paying off. So as much as you can with your constituents and the business community, those people that you interact with, I would like you to impart to them the importance of continuing these measures, and we're working on ways to phase them out, continuously being able to monitor that we're not going to see a disease resurgence. So it's a process getting life back to normal again. So the more that your constituents in our community can understand that, I think the less frustration there may be as the weather gets warmer and people want to be doing the things that they've become accustomed to doing in life.
I think it's important.
Mr. Mills?
I think it's
Oh,
important.
I'm sorry, Jack.
I think it's important that I agree. I think it's important we let people know that, this is working. Sort of the more it works, the less people might value it, but this is what success looks like, I suppose. And so thanks for coming up with that timeline. That will help us communicate with our constituents. Thank you, Doctor.
Mr. Mills?
Good morning, Doctor. As you know, there are 7 states that never really got into the idea of sequestering. There are also other states that are now looking to get out: Georgia, Tennessee, Colorado, Idaho, et cetera. I'm looking at their data and kind of wondering why California is taking such a draconian, in my world, approach to removing civil liberties from people where there has been no recorded deaths in this county, and not allowing our people to get out and to maintain some type of, I call it social activities that can help with their mental state as much as their physical state. As you know, you got a flurry of emails from me yesterday regarding our golf courses and what they're willing to do to get back to normal and how important those golf courses are. But they're just a small part of the overall situation of allowing people to get out and be active outside of their homes. What kind of a response do you think we need to have to this?
Well, Supervisor Mills, there is a stay-at-home order in effect from the governor by executive order that all Californians are subject to. And I think that it was California's early adoption of these social mitigation activities, which may seem draconian to some. However, they have shown to blunt the epidemic in California. And one of the main reasons that California, given our size and the early initiation of these stay-at-home practices and social mitigation activities, have really paid off in California being relatively spared compared to other states in terms of our burden of COVID-19 infection and the strain on the hospital system. So I understand the potential hardship that these efforts are exacting on the population. However, My job is to give you the medical and scientific guidance to protect the health of our community. And I think that if we take our foot off the throttle too soon, we're going to start to see those disease occurrences and overloading of the hospital system that we have been worried about all this time. So I think that's how I can best answer your concern.
Thank you.
Mr. Stopper?
From your starting statement, Dr. Kaleda, you were talking about you gave somewhat of a appearance of a timeline based on the facts as we proceed, which I can appreciate from your standpoint, trying to deliver the best scientific and, data moving forward to make the best judgment for the best of the community. I can tell you I completely support that, and I appreciate you looking into what it's going to look like as we move forward. And as you do that, Dr. Kaleda, anything you need from us to support you in that, we'll be right behind you.
Well, what I can say, Supervisor Stopper, is that Mr. Alt has been very helpful in the process of working with the golf courses and getting them sort of all on the same page about what factors would need to be put into place in order to allow them to resume their operations. For example, what ways can the contact, with the golf balls and social distancing of the golfers, disinfection of the golf carts, all of the practices that some communities that have allowed golf have required of the golf courses. So once we can get a set of best practices in order for the golf courses, they'll be one of the first non-essential activities to be able to resume in our community. So we've prioritized them, is what I would say.
It's not just about the golf courses, sir, but I do appreciate you looking into the different areas and ones that could be helpful for mental health at the same time, and at the same time put underneath the right criteria, they can still respect each other with social distancing for the better of the community.
Dr. K, how would this impact, and at what point would the Airbnbs, the B&Bs, the hotel motels start to be open for visitors coming in? Do you see that as being in the late summer category, or mid-June, early July when we start opening the restaurants?
Well, some of that is going to be based on what our local disease occurrence looks like, what our local impacts are, and some of that will be dependent upon what the state of California mandates are. So again, I'd like to remind us all that the governor of California, through executive order, has a statewide stay-at-home order in effect. So once and if and when that becomes rescinded, then I think based on our local disease activity, we can start to have a little bit more flexibility on when we want to start to institute recreational travel and recreational activities. So that's a distinction that I think is still covered by the current stay-at-home directives.
Okay, and what about the wineries being able to be open, at least for people to come in and purchase wine versus maybe wine tasting?
Well, and when I had set up my projections, and again, these are projections based on certain assumptions of limited disease activity and non-resurgence of cases. But in that mid-June to the end of July timeframe that I sketched out, that's when I would see the ability to start reopening of stores and restaurants with limiting numbers of patrons, wait staff, wearing personal protective equipment to certain degrees. And wineries would be in that category, in my opinion.
So in the process of doing this, we're then going to be inviting, whether it's stated or not, visitors into our county. So are we then going to be saying stay at home and visitors? Those are oxymoron terms. What are we saying? Yes, we're going to open a winery, or yes, we're going to open a restaurant under certain conditions. Yes, we're going to open golf courses under certain conditions. We're now inviting the non-essential traveling into the county. So how do you, and I guess OES, Al, how are you managing? How do you see this being managed?
Well, that's factored into the recommendations for relaxation of some of these social distancing and stay-at-home recommendations, and that's the balancing act that goes into that thinking and that equation. For example, there are people that right now want to see golf reinstituted in the community. Well, that's fine for local golfers and members of local golf courses, but then there's also the element of people coming from outside of the community to golf, and that's something that we want to regulate and manage. By mid-June to early July, we're talking about 3 months from now, 2.5 to 3 months from now, we would have to see disease activity diminished to the point where we would not only say that it's safe to start to reinstitute some of those non-essential activities, but also take into account that there may be other people from outside of our community coming in as well. So we would want to see regional disease activity on the decline as well before allowing that, because that's another factor to take into account when we relax some of our stay-at-home recommendations, is the influx of people from outside of our community that are going to be coming in to take advantage of some of these things. So I appreciate your concern, Madam Chair, and I think that if we wait to reinstitute these stay-at-home recommendations in a phased approach, we can take into account people coming into our community and have that still be safe.
Gary, did you have something you wanted to say?
Yeah, I did. Thank you, Dr. Kleda, for the update and all the work that you're doing. You mentioned that in September, the schools possibly would be reopening. And many of our children ride school buses to get to school. And it's the onset of the colder weather coming in that you mentioned that could show an increase without any inoculations or anything to help, drugs to help. Is that a concern that we should have with our kids sitting so close and all in a school bus riding together to go to school?
School in general is a higher risk activity. Anytime you congregate kids together, maintaining social distancing, hand hygiene, cough etiquette, all of those practices are a little bit more difficult in a school age population than in an adult population. So within the school setting, there are identified high risk settings: school bus and transportation, lunch, getting kids together for lunch, and the essential feeding and nourishment of the children is potentially a more high risk situation if you get kids together for in cafeterias and that kind of thing. So when it comes to reopening the school, those higher risk activities will definitely need to be taken into account, and mitigation activities are going to need to be put into place to prevent those high risk settings from being potentially causes of disease recurrence. And so that's going to be a conversation that our department and the schools are going to continue to have as time goes on, how to reinstitute school but keep it safe. School's not going to look the same once it goes back into effect. So when school is hopefully be able to resume in the fall, it won't be the same type of school environment that it was before the COVID-19 pandemic.
Supervisor Garamendi?
There we go. Thank you very much. And Gary, that was a really good question. I was thinking, while Doctor was responding to it, I was thinking, well, maybe the state will come up with some funding and we won't have to have 40 kids in a classroom. We could actually half those classes and be healthier. So it'd be awfully nice if there was a little silver lining for our education, but I'm not going to hold my breath. I also share the concern for outsiders coming up since we are winning in Calaveras. I'd hate to open ourselves up, but the question I've got is probably for Kristen. In reading the news, we've got a disproportionate share of senior citizens in our county per capita. So I want to know how and they seem to be the most vulnerable population as a whole. So I wanted to see how we're doing in keeping track of our nursing homes and our senior citizens. Because I read the stories about people being found in their home, and that's not a good way to go.
Good morning, Kristen Stranger, Health and Human Services. So yes, I think your point is not only well taken, but also on the forefront of everybody who's involved in the response efforts. I can tell you that we have had, through the collaboration through the Emergency Operations Center, a strong focus on addressing the needs of the vulnerable populations, including seniors. There's a number of partners who are regular providers of services, such as the Area Agency on Aging, Common Grounds, a local community-based partner, as well as Adult Protective Services, in-home supportive services, you know, the plethora of service providers who are engaged in doing whatever they can to not only meet the pre-existing needs of our older adults, but also be mindful of what those additional needs are in terms of in the wake of COVID-19. We're seeing things like beefed up check-ins, checking in on older adults. We have community campaigns where individuals are checking on their neighbors. You're seeing a lot of this kind of grassroots, wonderful neighbor to neighbor, which is probably arguably the most effective approach. And I would encourage our community to continue to check in on your loved ones, check in on your neighbors, and just see what you can do to help prevent them from needing to go to a grocery store, if you could do those types of things. In addition to our existing social and health services that focus on serving the needs of older adults, it's that, again, grassroots neighbor to neighbor stuff that in combination is going to be what creates the most effective outcomes.
Stranger, do you have anything else you want to add to the conversation this morning, please?
I do, yes. So I wanted to give an update on where we are in terms of Project Room Key, which was in early April. The board had given direction with staff to move forward with it. So as a reminder of what Project Room Key is a state-driven project to help provide shelter and wraparound support services during the COVID-19 response. The intent of the project is to help prevent the spread of COVID-19 by providing quarantine or isolation capacity to those who may not have it, and to protect the capacity of the local healthcare system by providing persons who do not need hospitalization the ability to care for themselves. Eligibility for this program is not determined by income, but rather by health and the need to protect both the individual and public health. There are a number of prioritized populations, which I have outlined before, but as a reminder, the priority populations are persons who have tested COVID-19 positive with mild to moderate symptoms and are not requiring hospitalization, but are in need of shelter to quarantine themselves. Number two, persons exposed to others who have tested positive for COVID-19 and who need isolation sheltering capacity. Number three, persons in high-risk categories needing isolation capacity. High-risk persons include those over 65, those with compromised immune systems, those with chronic respiratory or heart conditions. And finally, asymptomatic individuals that lack stable housing and need capacity to shelter in place. So just as an update of where we are in terms of rolling out Project Room Key, we are rounding out the procurement of the final wraparound support services. And you will see at your next meeting likely the very last round of contracts that are needed to put those remaining wraparound services in place. We are not live with Project Room Key yet, but I can tell you we did have a soft launch late last week, as we had an older adult with a compromised immune system that needed isolation because she resided with a COVID-19 positive family that we had identified during our epidemiological investigation. So even though we're not live yet with the actual project, we did have a soft launch because we had this need in the community, and this was the first individual that we were able to serve in this capacity. We, again, as I mentioned, we're fine-tuning our referral processes, fine-tuning those last of those contracts. We've got additional public health nursing staff assisting us. We have been very successful in obtaining a number of resources from the state through their escalation process in terms of if you identify a need you can't provide for. So we are finishing up securing the security, the private security, the housekeeping, the sanitation, the additional PPE, personal protective equipment that's needed, those types of things. And we anticipate being able to complete the week by, again, securing the remainder of those items so that we can look to launch likely next week. We do still have community members who are seeking capacity to shelter in place through existing funding sources that were part of systems and funding services through our coordinated entry way before COVID-19 became a concern. So we are still serving community members through existing systems, but again, the wraparound support services that complete and make up Project Roomkey are not quite fully implemented yet. I think that kind of that completes an update on the project as itself. I can take any questions that there may be right now.
Do any of you have, Mr. Stopper?
Not a question so much as I appreciate the hard work that you and Dr. Kaleda put in for the public health and safety of the community, Kristen. And I appreciate you doing all the homework and everything as we move forward. Keep up the hard work.
Thank you. I have to give a shout out to the Health and Human Services Agency as a whole, but also the public health team. The amount of work and things that we've been able to do so quickly, it's quite commendable, and it's really an honor to work side by side with them on this response of COVID-19, but then also launching Project Roomkey too. So kudos to them.
Well, even to go a little further, I mean, a lot of times you don't get credit for all the great things you do in the past. So, I mean, overall, this is 10 times what you normally have to go through, and you're always doing great things. So keep up the great work.
Thank you.
Ms. Stranger, what are we doing in the interim? I'm finding the process, it's nice, warm, fuzzy talk that we're going to do all this, but it's taking a long time. So in the interim, where are these people? Where are the homeless? I mean, how are we tracking that? How do we know that they're okay or that they're not okay?
So as I mentioned before, the individuals that lack stable housing are part of the priorities populations, right? They're number 4 on the prioritized populations because of the need to shelter in place. What we're doing currently is utilizing existing services that currently are in existence that are meant to help meet emergency shelter needs, and that's usually by ways of hotels, since that is our primary way of providing emergency shelter. So those individuals are still receiving services through the coordinated entry process, again with existing funding sources. I did pull some data most recently about those individuals that are currently being served through the existing services of coordinated entry. Currently, we are serving 21 individuals, including the one individual who is considered the official Project Roomkey because they were identified during the epidemiological investigation, and that's how Project Roomkey is going to more roll out. But 21 individuals, 20 needing the shelter in place capacity, 4 that are that have chronic health issues, 1 veteran, and 2 that are chronically homeless, with 0 that are out of the that are not from Calaveras County, that are not that are from out of the area. And I think that's important because the point in clarifying those individuals is one individual can fit within multiple categories, right? You can lack stable housing, and you can also have chronic health conditions. You could be needing to shelter in place, but you can be over 65. And so people have come with various types of needs and such. And so we're looking to, again, very quickly create this system of intake and referral processes. And I do anticipate with us being able to officially launch Project Roomkey next week after the Board of Supervisors meeting to finalize the last of the contracts.
Thank you. And the housing, excuse me, for first responders, is that that's already been resolved and they know where they can go?
So Project Room Key is meant to meet that need as well. So within those prioritized populations, again, going back to the concept of needing isolation, that could be a first responder. Those individuals right now would come from a public health referral. Again, we haven't gone live with the whole use this form to do this. We're working through those processes as fast as we possibly can. But if we learn of a first responder right now, or anybody who is needing to isolate due to those factors that I indicated before, testing positive for COVID-19 and don't have the ability to isolate at home, or whatever it might be, we would work that through kind of the soft launch like we just did with the individual who needed it, that we discovered during the epidemiological investigation.
So if you have a first responder who's not comfortable going home because of the work they're doing, is there not a place that's already been established for them?
So right now, the way that Dr. Clada's local health order is written, the short-term lodgings do have the ability to remain open if they are working to address the COVID-19 response, or they are providing a place for essential service workers to stay. So right now, if I was a person who if I was a first responder and I did not feel comfortable with going home for whatever it might be, my not wanting to expose my family, I can personally engage within, reach out to an individual hotel, and I can reserve a room. That is currently in existence. The process for Project Room Key, where we have those prioritized populations of who we would serve, which could also serve a first responder, is not fully implemented yet. But again, we do have kind of a soft launch that started where we could, and we typically learn about these individuals through the Emergency Operations Center, since we're all kind of working together through that collaboration. We would be able to serve them. And then lastly, I think another important point, because there's many arms of this response, right? And they're coming from various state oversight agencies. We also have the state launched through their Cal Travel Store, I believe it is called, a way for individuals who are healthcare workers and needing isolation to be able to access that state resource, and that's available online. And so again, you're seeing these different arms that are all doing what they can to braid together to try to address the overarching needs of the community.
Thank you. Are there any other questions for Mrs. Stranger? I'd like to open it up to the public. Does the public have any questions or comments they'd like to make?
So Madam Chair, again, we have the numbers and the meeting ID and the passwords on the screen for any members of the public that would like to call in. I think we might have one caller, so we'll go ahead with that. Caller ending in 886. You are live with the Board of Supervisors. Did you want to make a comment?
Hello?
Did you want to make a comment?
Can you hear me?
Yes. Did you want to make a comment?
Yes, let me gather my thoughts. We've been muted, and most of the public, I think, has been muted. That was made clear. Oh, thank you, by the way, for having me. It's just kind of difficult to get through. So I'm hearing, or from what I understand, that people are not going to be going back to work from this model that's been thrown out there until sometime in June. Is that going to be used as protocol for reopening our county? And then there was questions about the golf courses reopening, which is great, but obviously they're going to have employees at these golf courses. How are we going to mitigate that? Hello?
Yep, thank you. we're going to see if there's any others, and then we'll get back to you with answers. And thank you for the feedback on trying to get through. We appreciate it.
Yeah, that's the problem. We were muted from the very beginning, so maybe we could fix that for the next time.
Okay, thank you.
You're welcome.
There are no other callers, Madam Chair.
Okay. Ms. Stranger, would you like to answer the questions, or Dr. Kaleda? I think the ones on the golf course will just needs to be explained a little bit more, and that there will be a protocol for the golf courses to operate.
Yeah, I think you answered the question, Madam Chair, that there will need to be very strict protocols in place to keep golfers isolated, to disinfect and minimize the equipment that's necessary to perform golfing, to protect employees of golf courses. All of those go into the factors that would determine whether or not golf should be allowed again to proceed in our community. As far as the question about, well, we're not going to be able to go back to work until June. Well, it depends. It depends what kind of work we're talking about. We've already distinguished between essential and non-essential types of work, and essential types of business and services are continuing as we speak. Non-essential work and economic activity will have to be sort of phased back in again, as I discussed, depending on the factors of disease activity, whether or not we're seeing resurgence of cases, what are those specific types of work activities, and are they high risk activities, and are they considered ones that can be postponed or ones that should be allowed to proceed. An example would be a 60,000 person football game, right? That's going to be the last thing to be allowed to take place again, right? And so when it comes to businesses and work, it depends on what those businesses are and how those can be phased back in again, depending on the factors of disease activity and occurrence that are happening in our community.
Thank you. Are there any other comments from the board? Any? Thank you, Dr. Kaleda. Thank you, Mrs. Stranger. Appreciate it. And we will see you next week. I think I speak on behalf of the board. You can tell our OES manager we like his updates, his brief, and the fact that they're brief. That's also good. If there's nothing else, I'd like the two of them to go back to work.
Thank you. I just wanted to ask or remind the board and the public that our COVID-19 webpage is the most up-to-date information and resources available. That also includes a senior resource guide. So just going back to Supervisor Garamendi's question earlier, I did forget about that and then was reminded by my team. So a lot of information is available, a lot of resources are available, and I would just encourage that to be the information source.
Are they still using the community information line?
Yes, and that is plastered at the top of the COVID-19 webpage as well. So yes, the community resource line is available, as well as the webpage with the information as well.
Good, thank you. Thank you both very much. Okay, I'd like to move on to any announcements the supervisors might have. Well.
I sat in on the state Fish and Wildlife Commission meeting last week when they put forward their resolution on a lot of people call it fish miss, but when the opener will be across California. We were able to make comment as a majority of other counties that are primarily affected about this were. And I think they made a good decision at the state level to give local jurisdictions that local control as they move forward, more of a surgical tool, so that, you know, areas that are more hot spots, as Dr. Kaleda talked earlier, wouldn't necessarily open as soon, and others not so much. So it would be at the request of local jurisdictions to extend the opening of fishing. And there's 4 counties that were primarily asking for this. And if there's any direction moving forward towards that, we would have to talk to the director of Fish and Wildlife to facilitate that. At this time, there has been no plans put forward on that. And for the most part, my understanding with our order here, we have the fishing pretty much under control as it is. And that's all I have to report on for the Fish and Wildlife.
So there's not going to be an extension of the opening of trout season? That will still happen?
Trout season will open as scheduled unless otherwise requested and worked out with the director of Fish and Wildlife.
So again, that would mean visitors coming into the county.
Not necessarily, Marita, because you have to remember that parking areas, boat ramps, and other such things are closed down per the order right now. So I believe the tools are already in place so that it's not an easy access for people from out of the area. Let's put it that way.
So as far as Calaveras is concerned, trout season's opening the 25th of April or whatever, right?
As of right now, yes.
Okay, thank you. I have 2. I want to remind all of you that tomorrow's Earth Day. And I somewhat miss it because I always get to see Mark Dyken on Earth Day. So Supervisor Garamendi, if you happen to see Mr. Dyken, could you please tell him that this supervisor misses Earth Day, will miss Earth Day tomorrow.
Well, no, I'm not getting out much, Marita, so I don't know if I'm going to run into him anywhere, but if I do, I'll let him know.
Yeah, the radio station. Gary, are we still having Central Sierra Child Support on Monday?
Yes, as far as I know, yes.
Okay, got it. That's all I have. I'm missing my ice cream store, but I'm going for walks, and I hope all of you are getting some exercise. Mr. Alt. Oh, I'm sorry, Ben.
I was just to say, you can do some curbside pickup on ice cream down here.
Oh, I'm sort of loyal to the ice cream store in my district. I like to shop local. Mr. Alt, do you have anything? No. Mr. K?
No.
Ms. Everett?
No.
Okay, this meeting stands adjourned.
No,
Thank
it's
you.
Madam Chair. Session, so would you like me to read?
Got
the
it.
session?
We're doing that. Whatever Diane says, we're doing that. We're
Okay.
going into closed session. Thank you.
The closed session item is conference with legal counsel, anticipated litigation, significant exposure to litigation, one case pursuant to Government Code Section 54956.9D2. If you would like to make public comment on this agenda item, you may please call in now.
I'll learn. I'm assuming Al will be the host.
Yes, he will be the host of the meeting when we recess to closed session. If we can just give it another moment to see if anyone calls in on this agenda item. We don't seem to have any other callers, Madam Chair.
Okay. We'll close the meeting. Thank you.
Thank you.
Thank you.